Dr. Elena Vargas had been practicing cardiology for more than 20 years when she began noticing something curious about her most resilient patients. The ones who managed their blood pressure the best weren't always the ones on the most aggressive medication regimens. They were the ones who had learned to control something far more fundamental, something they carried with them every moment of every day, something completely free: their breath. What she discovered over those 2 decades of clinical observation became the foundation of her most important conversations with patients. Conversations that the pharmaceutical industry has little financial motivation to encourage, and that most medical schools simply don't have room to teach. The research, however, is anything but quiet on the subject. A landmark study published in a major hypertension research journal found that structured slow breathing reduced systolic blood pressure by an average of 15 points in participants who practice consistently. To put that in perspective, that kind of reduction is comparable to what many people achieve by adding an entirely new medication to their daily routine. Except this approach costs nothing, has no side effects, requires no prescription, and once you learn it, it belongs to you permanently. The reason breathing exercises produce such measurable results comes down to the direct relationship between your respiratory rhythm and your autonomic nervous system. When you breathe quickly and shallowly, the way most people do when they're stressed, anxious, or rushing through a busy day, your body interprets that pattern as a signal of danger. It responds by releasing stress hormones like cortisol and adrenaline. Your blood vessels constrict. Your heart rate climbs. Your blood pressure rises. The body is doing exactly what it was designed to do in a genuine emergency. The problem is that for many people, this pattern never fully shuts off. The emergency response becomes the default. And when your blood pressure is already elevated, that default setting becomes dangerous. Slow, intentional breathing sends the opposite signal. It activates what physiologists call the parasympathetic nervous system, the branch responsible for rest, recovery, and restoration. Your blood vessels dilate. Your heart rate steadies. Cortisol levels begin to fall. Blood pressure drops, often within minutes. The mechanism isn't mysterious or abstract. It's measurable, reproducible, and well-documented across hundreds of studies. Dr. Vargas developed a protocol built around 3 specific techniques, each with a distinct purpose and application. The first is what she calls the extended exhale method, a rhythmic breathing pattern where you inhale through the nose for 4 counts, hold the breath gently for 7 counts, then release slowly through the mouth for 8 full counts. The extended duration of the exhale is the key. When your exhale is significantly longer than your inhale, it triggers a cascade of parasympathetic activation that almost immediately begins to lower your heart rate and soften the tension in your blood vessels. She first introduced this technique to a patient named Arthur, a 72-year-old retired engineer whose blood pressure would reliably spike into the 160s over the mid-90s every time he encountered a stressful situation, a difficult phone call, a family argument, a night of poor sleep. His physician had already adjusted his medications twice in the past year without achieving consistent control over those stress-driven spikes. Within 2 minutes of walking Arthur through 4 complete cycles of the extended exhale technique, his systolic reading had dropped by more than 20 points. He wasn't cured. His blood pressure remained something to be carefully managed. But he now had a tool that worked faster than any oral medication he'd ever been prescribed, and he could use it anywhere, at any moment, without reaching for a pill bottle. The practice itself requires nothing more than a comfortable seated position, ideally with one hand resting gently on your abdomen. You want to feel that hand rise on the inhale. That rising sensation tells you the breath is reaching deep into your lungs rather than staying high and shallow in your chest. Begin by exhaling completely, emptying your lungs as fully as you comfortably can. Then close your mouth and draw a slow, steady breath in through your nose, letting the count of 4 guide your pace. At the top of the breath, hold, not a tense, strained hold, but a quiet, suspended pause through the count of 7. Then part your lips and release the breath smoothly and slowly over 8 full counts. That is 1 complete cycle. 4 cycles, practiced 4 times across the day: morning, midday, late afternoon, and again before sleep. Total less than 10 minutes of active practice. Yet the cumulative effect on your nervous system, measured over days and weeks, is profound. The second technique operates on a slightly different principle. Rather than manipulating the ratio of inhale to exhale, it focuses on achieving a specific respiratory rate that researchers have found to be optimal for cardiovascular regulation. When a person breathes at approximately 6 breath cycles per minute, 5 seconds in, 5 seconds out with no pause and no forcing, something remarkable happens in the body. Heart rate variability increases. The electrical activity of the heart and the rhythm of breathing begin to synchronize in a way that physiologists describe as resonance. Blood pressure steadies. Stress hormones decrease. The cardiovascular system enters a kind of coherent, stable rhythm that represents its most efficient and least stressed state. Dr. Vargas often described this technique as the maintenance practice, the one designed not for emergencies but for building a calmer baseline over time. She remembers a patient named Caroline, 76 years old, who had struggled for years with what is commonly called white coat hypertension. Her blood pressure readings at home were consistently normal, but the moment she sat down in a clinic waiting room, anxiety would drive her numbers into genuinely dangerous territory, sometimes reaching 170/100. Standard visits had become a source of escalating dread. After learning the 5-in, 5-out technique and committing to practicing it for 5 minutes in her car before each appointment, her readings at the clinic began to normalize. Her most recent checkup produced a reading of 134/80, a number her physician described as almost unrecognizable compared to what they'd been seeing for years. The beauty of this particular practice is its invisibility. You can do it anywhere without anyone around you noticing. In a waiting room, at a traffic light, during a commercial break, in a meeting where you feel tension rising. The breath stays quiet and natural. The count stays internal, and the effect accumulates with each repetition, each session, each week of consistent use. The third technique is the one Dr. Vargas reserved for what she called crisis moments. Those sudden spikes in pressure that can accompany a shock, an argument, a surge of panic, or a startling piece of news. It draws from an ancient tradition of yogic breathing practice that modern researchers have spent considerable effort studying, and the clinical findings have repeatedly confirmed what practitioners have observed for millennia. By alternating the flow of breath between the left and right nostrils using a simple hand position, you engage both hemispheres of the brain in a way that rapidly neutralizes the stress response and restores equilibrium to the autonomic nervous system. The technique works as follows. Raise your right hand to your face and position your thumb lightly against your right nostril and your ring finger lightly against your left. Let your 2 middle fingers rest gently on your forehead or fold them inward, whichever feels natural. Close your right nostril with your thumb and breathe in slowly through your left nostril over 4 counts. Then close your left nostril with your ring finger, release your thumb, and exhale through your right nostril over 4 counts. Without changing your hand position, inhale now through your right nostril over 4 counts. Close the right nostril with your thumb, release the ring finger, and exhale through your left nostril over 4 counts. That is 1 complete cycle. The rhythm is slow, deliberate, and deeply calming. Most people notice a shift in their nervous system within the first 2 or 3 cycles. A patient named Theodore, 68 years old, had been experiencing nocturnal blood pressure spikes that were sending his readings into the 180s late at night. The spikes would wake him from sleep. The waking would cause panic. The panic would drive the numbers even higher. He had already made 2 nighttime visits to an emergency facility in a single year. After learning the alternating nostril technique and practicing it for 5 minutes during those nighttime episodes, his readings during subsequent spikes consistently came down into the 150s, still elevated, still requiring ongoing medical management, but no longer representing a crisis requiring emergency intervention. He has not returned to the emergency room in the 18 months since. The full protocol, used together, creates a layered approach to blood pressure regulation that addresses multiple timescales simultaneously. The extended exhale technique trains the nervous system through 4 brief daily sessions, building a calmer default state over weeks. The resonant breathing practice deepens that effect through longer, more meditative sessions in the morning and evening, rebuilding your cardiovascular baseline from the ground up. And the alternating nostril technique stands ready as an immediate intervention whenever a spike or a surge of stress demands rapid action. The most compelling testimony to this integrated approach came from a woman named Diane, 73 years old, who arrived at Dr. Vargas's clinic with an average blood pressure of 156/93 despite already taking 2 different antihypertensive medications. Her physician had begun discussing the addition of a third. Diane asked for 90 days to try something different. She committed fully to all 3 techniques: the extended exhale 4 times daily, resonant breathing for 10 minutes each evening, and the alternating nostril method whenever she felt stress rising. At her 3-month follow-up, her average reading had fallen to 131/77, still on her original 2 medications. No additions. 25 points of systolic reduction from breathing practice alone. Her physician agreed to postpone the 3rd medication indefinitely. 2 years later, her blood pressure remains controlled, and she continues the practice every single day. What makes these results possible is not magic, and it is not placebo. It is the simple physiological fact that your nervous system is listening to every breath you take, and it is responding accordingly. When you breathe in patterns that signal safety and calm, your body creates the internal conditions of safety and calm. Dilated blood vessels, steady heart rate, lowered cortisol, reduced vascular resistance, and falling blood pressure. The body does not distinguish between real calm and deliberately practiced calm. It simply responds to the signal it receives. The starting point is always the same. Take a baseline blood pressure reading if you have a home monitor. Write it down. Choose the technique that feels most accessible. For most people new to this practice, the resonant 5-count breathing is the gentlest entry point. Set a timer for 5 minutes and practice without distraction, with your full attention on the physical sensation of the breath. When the timer goes off, take another reading. The difference you see in those 2 numbers is not anecdotal. It is your own body confirming in real time that the technique works. From there, the only variable that determines long-term results is consistency. These techniques require no equipment, no appointment, no financial investment, and no special physical condition. They require only the decision to practice every morning, every evening, and every time your body signals that it needs support. Like all habits that reshape physiology, the benefits compound quietly over days and weeks until the calmer state stops feeling like something you have to create and starts feeling like simply who you are. Share this information with anyone in your life managing high blood pressure. Encourage them to speak with their physician about integrating breath work into their treatment plan. And if your own numbers have been telling you that something needs to change, understand that one of the most powerful tools for changing them has been with you every moment of your life, waiting only for you to use it.